Potential here, our first learning objective is to explain the ionic basis of the resting membrane potential. So I like to spend some time zooming out here and really setting the scene for the big picture before we actually get into the details of the membrane potential. And so what we're going to speak about is how we go from a resting cell. Specifically, we're looking at our excitable cells. And when we say excitable cells, we're talking about neurons or even muscle cells. And these are cells that have a resting potential. Cardiac cells are another example of this, but these cells have a resting potential and then they have the ability to be excited. When they are excited or activated, they're going to do something different. In the case of a neuron, neurons basically speak to each other. The nervous system in general is the major communication highway of the body. This is how signals are sent and received, right, from the brain, but also out in our peripheral organs. This is how muscles contract and move. All of our movements, all of our, body behaviors are brought about by that communication happening through neurons and as well as that coordination with muscle, right? Muscles contracting. So what we're going to speak about is how those cells can go from not contracted or not excited to then becoming excited, where they can contract or send signals to one another and allow for that type of communication. And so what we're going to look at is the ionic basis of that. Essentially, all of these overt behaviors that we see in the body are a reflection of the movement of ions, which is really fascinating if you think about it. So ions like sodium and potassium mainly are moving and they're creating excitement in these cells that allow us to actually bring about physical work. So that's what we're going to describe. And we're going to look at some terminology that will help us describe that. And we're also going to look at the relative distribution of sodium and potassium mainly. So in order for us to think about the state of a resting cell, we're going to theoretically start by looking at sodium first, and then potassium, and then we're going to bring those two things together. So we're going to determine the equilibrium potentials for potassium and then sodium, because we know that both of these ions are moving in a typical neuron or muscle cell. And so in order to better understand how they contribute to the resting membrane potential, we're going to isolate them for a little bit, look at them independently, and then think about how they can collectively bring about that resting membrane potential. Now, the resting membrane potential exists because there are more negative charges inside the cell and more positive charge on the outside of the cell. This is a phenomenon that we described previously, right? We talked about the polarity of the cell. Now, all cells will have a resting membrane potential. That value is going to differ depending on the specific cell. So it's going to be anywhere from -5 millivolts all the way to -100 millivolts. But when we think about our neuron, and the neuron is the main cell that we're going to focus on, it has a resting membrane potential of approximately -70 millivolts. Okay, we'll talk about cardiac muscle cells, which are about -90 millivolts later on as well. And so if we want to think about determining the equilibrium potential for each of these ions, we're going to have to look at the two factors that will help us determine the resting membrane potential. So one is the ion concentration gradient. So which side of the cell has a higher or lower concentration of the ions that we're looking at, right? This is synonymous with the chemical driving force that we talked about previously. So that's going to be the first factor we're going to look at. The second factor is going to be the membrane permeability to these ions. And when I say membrane permeability, you should automatically be thinking ion channel, right? Because previously we discussed that ions cannot freely go through the membrane, okay? And so in order for us to think about the ability of an ion to move through the membrane, there must be a channel present. And so when I tell you that the membrane permeability for an ion increases, that simply means that more ion channels open up, right? More ion channels are available. And if I tell you the membrane permeability for an ion decreases, that will also mean that less of those ion channels are opening. So the permeability with respect to ion movement is always dependent upon the number of ion channels and whether or not they're open that are present in the membrane. All right, so our concentration gradient is the first factor. How much of the ion is present on either side of the membrane? The membrane permeability is also important, and that's going to be dependent on the state and the number of ion channels for that ion. Some of the terms we want to become familiar with are listed in this table. I don't need you to memorize any of these necessarily, but this is a good reference point because we're going to use these terms to describe how we get at the resting membrane potential. So, for example, the resting membrane potential here is described as the difference in voltage across the plasma membrane when the cell is at rest, right? When it is not excited, when it is resting. What is the different proportions of ions across the membrane look like? So we'll talk about things like the membrane potential, which is the difference in voltage. Basically, the inside of the cell is what we're referring to when we talk about the membrane potential. And then we'll also look at terms like the graded potential, which is basically that small jolt of energy. So this is a table to come back to. As we go forward, you're going to use these terms to describe various aspects of the resting membrane potential. And so just always come back here as a way to make sure you're understanding what these terms mean. So the first thing we'll describe is the sodium-potassium pump, all right? And this should be familiar to us, right? We talked about this as the main mechanism of primary active transport, but also it's the mechanism of coordinating with the leak channels to keep the relative ion distribution constant. And so the sodium-potassium pump is going to contribute to 20% of the resting membrane potential directly. And that is because of the way that it is pumping ions. So it's pumping sodium out, 3 sodiums out of the cell, 2 potassiums into the cell. And so because it is allowing for more sodiums to leave than potassiums are coming in, there's going to be a net positive charge accumulating on the outside of the cell. What does that mean? There's going to be more positive charge leaving the cell than is being pumped into the cell. And so 20% of the resting membrane potential, 20% of that negative 70 value is coming directly from the sodium-potassium pump because it is allowing more positive to leave, and so a more negative is going to be on the inside. Now, the other 80% of that resting membrane potential is indirectly owed to the sodium-potassium pump. So when we pump sodium out of the cell, there's more of a high concentration of sodium on the outside and a lower concentration of sodium on the inside. So guess what? We now have a gradient. We have a gradient where sodium wants to passively move back inside the cell. All right? The same is true for potassium. Because the sodium-potassium pump is pumping 2 potassiums into the cell and 3 sodiums out, there's now a potassium gradient because there is more potassium on the inside and less potassium on the outside. So potassium now wants to passively leak down its concentration gradient from the inside of the cell to the outside of the cell. So that is to say that 80% of that negative 70 value is indirectly owed to the sodium-potassium pump because the sodium-potassium pump creates the gradient where these ions can leak in the opposite direction, okay? So the sodium-potassium pump is really important for us to begin explaining how we have the relative distribution of sodium and potassium. Okay, the other piece that we need to explain before we can start looking at our 2 ions independently is a typical neuron and what its permeability looks like for each of our ions. So the permeability for potassium is 25 times more than it is for sodium. In other words, there are more doors. Whenever I talk about permeability and ions, I like to refer to this as doorways or passageways, right? Because we know that this is the way that an ion channel behaves. It allows for that movement of the ion in question. So for us to say that the membrane is 25 times more permeable to potassium, that is to say that the membrane has 25 times more potassium channels than it does sodium channels. So potassium can move more freely across the membrane than sodium can. The other thing is to think about the ion distribution. So on the outside of the cell, we have an excess of sodium ions, but that is being equally balanced by an excess of chloride ions. And so sodium is positive, chloride is negative, and so both of those ions are distributed on the outside of the cell. On the inside of the cell, we have an abundance of potassium ions, and then that is going to be balanced by organic anions. And organic anions are going to be negatively charged. And once again, they're going to help balance the abundance of positive or potassium ions on the inside of the cell. So those are two important things to bear in mind as we go forward and begin to look at our ions independently. All right. So the first ion we're going to look at is potassium. Okay, we're going to think about potassium's chemical driving force. We're going to think about potassium's electrical driving force, and then we're going to put those two pieces together and think about potassium's electrochemical driving force separately, and then we will do the same for sodium. So potassium has a higher concentration on the inside of the cell. Remember, we want to think about our sodium-potassium pump. Because it's on the membrane, it's pumping potassium into the cell. And so it is creating an abundance of this positive ion on the inside of the cell. So more potassium inside, and that is somewhat being balanced by the abundance of organic anions. So here is the organic anions that are sort of balancing out the potassiums on the inside of the cell. So potassium can be pumped into the cell actively, but then it's going to passively diffuse or leak out of the cell. And so the concentration gradient allows potassium to move from the inside of the cell to the outside of the cell down that concentration gradient. And the other thing I want to say here is that in order for us to independently look at potassium, we're going to look at a hypothetical cell. So the hypothetical cell that we're describing here is only permeable to potassium. Now, we know that in our body, that's not true. There are no cells that are only permeable to potassium, right? But hypothetically, we're going to describe this cell just so that we can understand what's happening with potassium. And then we're going to do the same for sodium, and then we're going to put it together. So when we see that this written at the top here, cell permeable to potassium only, understand that that is a hypothetical scenario just so that we can isolate potassium and study its movement better, and then begin to combine that with sodium later on. Now, as potassium diffuses outside of the cell, right, according to that concentration gradient or that chemical driving force, we can now begin to consider the electrical driving force and where that would want to move potassium. So because on the inside of the cell, there is now more of a negative charge. Remember, potassium is positively charged. And because of its concentration gradient, it is now moving outside the cell. So it's going to begin to leave an unopposed negative charge on the inside of the cell. So those organic anions that we described previously are going to be left behind as potassium leaves the cell. And so they're going to start to create a negative environment on the inside of the cell. And we know in order for us to look at the electrical driving force, we have to consider the polarity of the cell. Which environment has the abundance of negative and positive charge respectively? So because the inside of our cell begins to become more negative, and potassium is a positively charged ion, potassium is going to be attracted back to the inside of the cell, which has the abundance of negative charge. Okay, therefore, the concentration gradient wants to move potassium out of the cell, but then the electrical driving force wants to move it back into the cell where that positive ion is attracted to the negative environment. So the cell will eventually reach at equilibrium, and that is where it is going to get to a state where the chemical and electrical driving forces are the same magnitude, but just in opposite directions. And so here we can see that value, that equilibrium, is going to be negative 94 millivolts, and that is the membrane potential at which potassium is now at equilibrium. all right? So its forces are now balanced out in terms of the opposite movements, and the magnitude will be the same. Okay, and so just to remind ourselves here what we mean by an ion being at equilibrium. So we discussed this earlier, but this is where the chemical force is equal to the negative electrical force. In other words, the forces cancel out. So the chemical force is moving in one direction, the electrical force is moving in the opposite direction. And so the magnitude is the exact same, right? Just equal and opposite. And so the electrochemical force is going to be equal to 0. So at this state, the ion is no longer moving because its forces to move are equal and opposite, and they've canceled out. Okay, so that was our hypothetical cell for potassium. We see that potassium is going to want to move in opposite directions simply because its chemical driving force is moving out, its electrical driving force is moving in, and then when it gets to equilibrium, that negative 94 millivolts is the membrane potential in that state, and the potassium is no longer moving because the forces cancel out. Now let's consider sodium. So sodium is going to be the other ion that we want to think about that has the most impact on the resting membrane potential. And so likewise, we're going to think about a hypothetical cell that is only permeable to sodium. We're going to look at the ion distribution, we're going to look at the chemical driving force, and then the electrical driving force. And then we're going to think about what direction sodium wants to move if we combine those two forces. So the same ion distribution is going to be true here as well. Sodium is at an abundance on the outside and it is balanced by chloride. Potassium is at an abundance on the inside and it is balanced by organic anions. So let's start by looking at the chemical driving force for sodium. So sodium has a higher concentration on the outside of the cell. And I keep bringing up the reason here. Remember, the reason for this is that sodium-potassium pump. So the sodium-potassium pump is pumping sodium out, right? 3 sodium specifically. And so there's going to be an accumulation of sodium at a higher concentration on the outside of the cell and at a lower concentration on the inside. It is going to be balanced by chloride. So on the outside of the cell, the abundance of sodium ions are sort of balanced out by the chloride anions, which are negative. And so if we think about the direction with which sodium wants to move according to its concentration gradient, it's going to be inside of the cell from a high concentration to a low concentration. Now, as sodium begins to diffuse into the cell, remember this is a process, right? So as the concentration gradient wants to move sodium into the cell and sodium begins to diffuse into the cell, we're now going to see that there's an unopposed negative charge left behind on the outside, all right? So the electrical force is going to want to move sodium back to the outside of the cell. Remember, sodium is positively charged, so as it diffuses on the inside of the cell, more negative is left outside, owed to that chloride that we talked about earlier. And so now we have a negative environment outside of the cell. And so the electrical driving force for sodium initially, really important that we stress initially here, because this will eventually flip-flop, but the initial electrical driving force is to move sodium to the outside of the cell because it is positively charged and the outside of the cell is initially negatively charged. Okay. What eventually happens is a cell will continue to move ions. It will eventually reach equilibrium. And so the equilibrium potential for sodium is actually positive 60 millivolts. So it's way more positive than the equilibrium potential for potassium. Okay, that is to say that when the cell stops moving sodium, the membrane potential at that state, at that time, is positive 60 millivolts. Okay, in other words, this is the state where the sodium movement is halted because the electrical force is equal and opposite to the chemical force, and the ECDF is now 0. Okay. So we've got two forces acting on sodium, chemical wanting to move it into the cell, electrical wanting to move it out of the cell. And so the net force is initially in, but because we have a stronger chemical driving force, the electrical force will continue to increase. And then what we're going to see is that sodium eventually is going to want to move onto the outside of the cell according to its electrical driving force, right? So we'll illustrate that coming up here. So now that we put our two ions together, sodium and potassium, right? Here's our cell. We want to now begin to think about the permeability, the difference in the permeability. First, we want to think about our chemical driving force for both of these. So there's more sodium outside, so the chemical driving force for sodium is into the cell. There's more potassium inside, so the chemical driving force for potassium is out of the cell, right? That's the first step. Then we think about the permeability. Remember, the permeability is the ultimate factor that will determine the ionic movement, because we said that in order for ions to move, there must be channels present in the membrane to facilitate ionic movement. So because we know that potassium is more permeable, in other words, there are more potassium channels. Potassium is going to leave the cell at a faster rate than sodium can come in. So even though we have an equal concentration gradient for both of these ions, in actuality, potassium has more of an opportunity to move because potassium has more channels, because the membrane is more permeable to potassium. Sodium has less opportunities to move because the membrane is less permeable to sodium. So as we begin to move our ions according to their concentration gradient, but limited by the permeability, right, the number of channels, we see that potassium can leave more than sodium can come in. And so what that creates is a negative environment on the inside of the cell because more potassium is leaving, and potassium is positively charged, and less sodium can come in. And so the abundance of negative charge creates a negative environment on the inside of the cell. And then the abundance of positive charge that has an opportunity to leave creates a positive environment on the outside of the cell. So what I really want to stress here is that even though both ions are positively charged and both ions have an opposite concentration gradient, sodium wanting to move in, potassium wanting to move out. Because of the difference in permeability, we're going to begin to see that more positive charge leaves the cell net than what can come in. And so this is how we get that negative environment on the inside of the cell. All right. So that's really important to take into consideration. Now we can look at the electrical driving force. So remember, in order to think about the electrical driving force, we have to understand the polarity of the cell. We have to understand where is there an abundance of negative/positive. And so that is what we just described, really based on the permeability of the cell. So now when we think about the electrical driving force, the inside of the cell is negative, and so both of our ions really want to get inside the cell. So sodium wants to get inside the cell to that negative area, potassium wants to get inside the cell to that negative area. And due to the electrical forces, potassium is going to want to flow into the cell. Its concentration gradient is moving out of the cell. So potassium wants to come in according to the electrical force, but out according to the chemical force. So if we think about potassium's movement, we're going to have to think about our algorithm. We're going to have to subtract the weaker force from the stronger force. And so what we will see is that potassium will leave the cell, right? Because the stronger force is the chemical driving force, right? The bigger arrow here. And so it's going to be a weaker magnitude, but an overall direction out of the cell. Sodium, on the other hand, both of its driving forces are now moving into the cell. So again, thinking back to our algorithm, we're going to simply combine the magnitude, which means it's going to be a bigger magnitude, and then it's going to be moving in the overall direction into the cell. And so as we put all of these moving pieces together, potassium is going to move out of the cell, but slowly. even though it has more doors, it has an opposing force. So even though it has more doors, more channels, and the membrane is more permeable to potassium, there's a force that's kind of pulling it back in the opposite direction. And so we're going to subtract that force, and it's going to have a slower overall force moving out of the cell. Sodium, on the other hand, both of its forces are moving into the same direction, into the cell. So it's going to have a really strong force. As we combine those two magnitudes, it's going to have a speed, right? It's not going to be slow. It's going to be a speed or a rush of sodium that wants to get into the cell because both of its forces are wanting to move in that direction. And so that is basically how we move ions. So sodium trickling out of the cell, but using more doors, there's more permeability for sodium, for potassium movement. Potassium, that is, trickling out of the cell, but having more doorways to do so. Sodium rushing into the cell, right, with that stronger force, but having less doorways to do so. And that creates a steady state. So the inflow of sodium is now going to be balanced out by the outflux of potassium. And then we also have the sodium-potassium pump on the membrane reestablishing these gradients and keeping the system going. And then this entire system gets to a steady state. And by steady state, we mean there's no longer any net accumulation of ions on either side. So this is how we get that resting membrane potential value of -70. Right? So just to recap here, we think about all the factors involved. We think about the concentration gradient of our ions. We think about the permeability of our ions and how that differs. We think about the polarity of the cell that is created because of our differing permeability, right? Because there's more doors for potassium, more positive charge gets to leave the cell. So now we create this negative environment on the inside. Now we can introduce our electrical driving force. And so our electrical driving force is going to want to move both ions inside of the cell, right? Because there's more negative charge inside. Now we can think about looking at combining the forces. So if we combine potassium's force, the concentration gradient wants to go out, the electrical gradient wants to go in, and so sodium is going to trickle out of the cell because it has that opposing force trying to pull it in. If we combine, I keep saying sodium, that's potassium. So potassium is trickling out of the cell with that opposing electrical force that is preventing it from moving as quickly. Sodium, on the other hand, has less doors, less channels, but it has both of its forces moving in the same overall direction. So we simply combine those two forces, and so sodium is going to want to rush into the cell. So we have potassium trickling out, but having more doors to do so. Sodium rushing in, but having less doors to do so. And then that is how we end up balancing out the movement of our ions. And then the sodium-potassium pump also helping to maintain that movement, right? Maintain the gradients that allow for this movement.